1. When developing a training module for new Medical Laboratory Professionals Association of Ontario (MLPAO) members, which principle of adult learning is most critical to foster engagement? A. Reliance on rote memorization. B. Linking content to prior professional experiences. C. Delivering information only through lectures. D. Avoiding learner involvement in assessments. 2. A mentor is guiding a new laboratory professional preparing for the MLPAO test. Which approach aligns with best mentoring practices? A. Directly providing test answers for efficiency. B. Encouraging reflective practice and critical thinking. C. Limiting discussion to only technical content. D. Focusing solely on memorization of regulatory guidelines. 3. In curriculum development for MLPAO test preparation, which step ensures alignment with professional standards? A. Creating test questions without referencing competencies. B. Mapping objectives to regulatory and professional benchmarks. C. Designing materials based solely on instructor preference. D. Prioritizing convenience over rigor. 4. When evaluating MLPAO exam readiness, which tool is most effective for providing formative feedback? A. Randomized summative tests only. B. Structured peer feedback sessions. C. Eliminating feedback until final results. D. Relying on passive observation. 5. Communication barriers during MLPAO mentoring sessions are best minimized by A. Using technical jargon exclusively. B. Encouraging open-ended questions. C. Avoiding clarification requests. D. Focusing strictly on written communication. 6. Which evaluation method best measures critical thinking for MLPAO candidates? A. Multiple choice recall tests. B. Scenario-based case analyses. C. True-false quizzes. D. Matching definitions to terms. 7. An MLPAO instructor uses role-playing exercises in class. This technique primarily supports A. Adult learners' need for experiential learning. B. Rote memorization of technical facts. C. Passive lecture-based instruction. D. Exclusion of learner interaction. 8. Which aspect of regulatory compliance is most emphasized in the MLPAO testing framework? A. Adherence to evidence-based laboratory practice standards. B. Ignoring international best practices. C. Prioritizing speed over accuracy. D. Excluding ethical considerations. 9. To promote learner motivation in MLPAO exam prep, an instructor should A. Provide immediate rewards for correct answers. B. Connect testing scenarios to real clinical impact. C. Discourage questions during lessons. D. Focus exclusively on final scores. 10. Which mentoring technique best addresses diverse learning styles for MLPAO candidates? A. Using a single instructional method for all learners. B. Integrating visual, auditory, and kinesthetic strategies. C. Delivering identical test prep sessions regardless of feedback. D. Avoiding learner-centered adjustments. 11. When constructing MLPAO exam questions, curriculum developers must ensure that items A. Reflect core professional competencies and standards. B. Are based on anecdotal clinical experiences only. C. Emphasize obscure technical jargon. D. Require memorization without application. 12. What is the primary ethical obligation of mentors preparing candidates for the MLPAO exam? A. Ensuring integrity of test preparation practices. B. Guaranteeing perfect scores for all candidates. C. Limiting access to preparation materials. D. Encouraging shortcuts to success. 13. In evaluating the effectiveness of MLPAO preparatory workshops, the most valid indicator is A. Learner satisfaction surveys only. B. Increased pass rates and competency demonstration. C. The popularity of the instructor. D. Attendance numbers without performance data. 14. Which communication strategy best fosters collaboration in MLPAO test preparation groups? A. Encouraging active listening and feedback loops. B. Restricting dialogue to instructor monologues. C. Prioritizing written exams over discussion. D. Discouraging peer-to-peer interaction. 15. In curriculum development, the most effective sequencing for MLPAO content delivery is A. From basic competencies to advanced applications. E. From advanced applications to unrelated topics. C. In random order to challenge memory. D. Focused solely on exam trivia. 16. Which adult learning principle ensures MLPAO learners remain self-directed? A. Granting autonomy in setting learning goals. B. Requiring strict instructor control over pacing. C. Eliminating opportunities for learner choice. D. Avoiding connections to clinical experience. 17. When assessing communication skills in the MLPAO exam, the best evaluation method is A. Standardized oral case scenarios. B. Silent written tests only. C. Group observation without structured criteria. D. Automated grading of vocabulary use. 18. What is the primary role of formative assessment in MLPAO preparation? A. To provide ongoing feedback for improvement. B. To finalize grades and scores. C. To replace summative assessment entirely. D. To delay feedback until test completion. 19. A mentor reviewing an MLPAO candidate's mock test identifies recurring mistakes. The mentor should A. Provide constructive feedback with corrective strategies. B. Ignore errors to boost confidence. C. Redesign the entire curriculum immediately. D. Discourage further test practice. 20. Which regulatory principle underpins MLPAO professional practice testing? A. Accountability to public safety and ethical standards. B. Avoidance of standardized competency benchmarks. C. Emphasis on speed over procedural accuracy. D. Minimization of record keeping. 21. In MLPAO workshops, peer teaching activities are used primarily to A. Reinforce collaborative knowledge construction. B. Limit learners' exposure to new material. C. Replace formal instruction completely. D. Focus solely on individual performance. 22. Which evaluation method provides the most reliable measure of test readiness? A. Competency-based simulated assessments. B. Instructor impressions without rubrics. C. Informal discussion only. D. Attendance tracking. 23. A new curriculum for MLPAO exam prep integrates case-based learning. This reflects A. Alignment with adult learners' preference for real-world relevance. B. A focus on passive memorization. C. Avoidance of applied critical thinking. D. Exclusion of clinical scenarios. 24. What is the key benefit of mentoring MLPAO candidates using reflective practice journals? A. Enhancing self-awareness and professional growth. B. Limiting creativity and learning. C. Encouraging dependence on mentors' notes. D. Reducing learner accountability. 25. Which instructional strategy aligns with best practices for teaching regulatory compliance in MLPAO prep? A. Using real case studies of laboratory incidents. B. Memorizing compliance codes without context. C. Avoiding discussion of legal frameworks. D. Relying on outdated examples. 26. In designing evaluation rubrics for MLPAO practice assessments, it is essential to A. Define clear, measurable performance criteria. B. Keep criteria vague to allow flexibility. C. Focus on subjective instructor judgment. D. Limit assessment to binary right-wrong outcomes. 27. A mentor observes that an MLPAO candidate struggles with applying theoretical knowledge. The most effective intervention is A. Incorporating simulation-based training exercises. B. Assigning additional rote memorization tasks. C. Discouraging the candidate from continuing. D. Reducing exposure to practical scenarios. 28. Effective communication in MLPAO exam instruction should prioritize A. Clarity, conciseness, and responsiveness. B. Complex terminology without explanation. C. Rapid delivery of unstructured content. D. Avoidance of learner questions. 29. The MLPAO exam framework emphasizes which element in evaluating laboratory professionals? A. Competency, safety, and ethical practice. B. Memorization of irrelevant content. C. Personal instructor preferences. D. Exclusively international regulations. 30. Which mentoring practice best promotes long-term professional growth in MLPAO candidates? A. Encouraging lifelong learning habits and self-assessment. B. Ensuring dependency on mentor guidance. C. Limiting exposure to advanced concepts. D. Focusing only on passing the current test.